Hello everyone, I am Dr. Parag Telang, plastic reconstructive and facial feminization surgeon and Director and Chief Cosmetic Plastic Surgeon at Designer Bodies, Center for Advanced Cosmetic and Plastic Surgery in Mumbai. Recently, we have been getting a lot of queries about facial feminization surgeries. Since it is a less talked about subject in India, people have so many doubts and misconceptions about these procedures. So today, I am here to discuss some of the most popular cosmetic surgeries for facial feminization. These surgeries can bring a drastic change in one's appearance as desired. These are highly customizable and require a holistic approach wherein we consider the entire face as a unit while making changes in particular features of the face. This also requires an artistic eye for the final results to be natural, pleasing and harmonious. As we all know, our facial appearance plays a huge role in our interactions, social activities and personality. Many people, especially transgender women, assigned males at birth, non-binary trans people and females who are not satisfied with their facial appearance can get the desired feminine look with facial feminization surgery. As the name indicates, the main aim of these surgeries is to transform masculine features into feminine. This surgery involves a series of advanced surgical techniques that are derived from craniomaxillofacial surgery and plastic surgery that aim to soften the facial appearance. These procedures are for people who are dealing with gender dysphoria and often try to hide their inner selves because of their appearance. Now, the question arises, what is gender dysphoria? It is a condition in which an individual faces distress because there is a gender mismatch between the assigned gender at birth and the gender that is identified by the person. The right approach to address gender dysphoria involves counseling, sex hormones therapy and gender affirming surgeries. Facial feminization surgery is a major part of gender affirming surgery and includes a set of surgical procedures that adjust the masculine facial characteristics that play an important role in ascribing gender. The surgery helps one to live freely by helping them to achieve the desired appearance. The modification and elimination of masculine facial features allows the patients to adapt more easily in their workplace and family environment. Facial features that strongly contribute to gender discernment include supraorbital ridge, structure of the nose, prominence of the jaw and the chin. Facial feminization surgery alters the anatomic characteristics to give satisfying results to the patient. Before conducting the FFA surgery, we conduct physical examination, unenhanced facial CT scans to get more information about the patient's facial anatomy and skeletal structures like the orbit, the frontal sinus and many more areas so that the patient can be advised about the changes that are going to be made during the procedure. Now let us discuss the popularly performed facial feminization surgeries that reduce the masculine facial features and create a more feminine appearance. The first one is forehead feminization surgery, which is also known as forehead reduction or forehead contouring surgery. Forehead reconstruction surgery is a type of craniofacial surgical procedure and is mainly performed for aesthetic purposes, and the surgery must be performed by a skilled surgeon who is an expert in both plastic and craniofacial surgery. Now, forehead contributes 40% of our entire facial structure and shape of the forehead plays an important role in gender expression. For cisgender and transgender people, forehead reduction surgery can help create a more harmonious facial appearance that aesthetically relates to other facial features. The procedure alters the delicate bones around the eye socket, minimizes the bony ridges and prominence of the forehead and helps to feminize the upper facial areas. Anyone who feels that their forehead is oddly shaped or it's too prominent can also opt for this surgery. In this procedure, the hairline is lowered and the scalp is advanced so that the hairline becomes far ahead. The brow bone is osteotomized and reconstructed to reduce the forehead size. Orbital and frontal bones are also modified to deliver a harmonious and aesthetically pleasing result. The scars of the surgery are strategically placed in the hairline area to offer the best results without any visible surgical scars. The second most popular surgery is nose feminization. Nose is in the mid face and the shape and structure of our nose plays an important role in overall facial appearance. A feminizing nose rhinoplasty is performed to complement the degree of the frontal contouring and increasing the nasofrontal and nasolabial angles. The shape of the male nose is usually larger, wider, more angular, while the female nose tends to be longer with a slopy tip pointing upwards. To make the male nose appear more feminine, it needs to be reshaped and refined, ensuring that it retains aesthetic harmony. The surgery aims to alter the nose shape and profile to make it look more feminine. The surgery must be performed by an expert surgeon who has deep understanding of the aesthetic qualities so that the patient can achieve their goal of facial gender confirmation. The transition between the male nose and forehead area is more sharp and prominent. Female noses are less prominent and they tend to have a more narrow, straight and gentle curve. Nose feminization surgery can make the nose look smaller and the tip can also be discreetly filled. In this procedure, the tip is refined, the nasal bone and nostrils are narrowed to get an overall more feminine nose shape. Before the surgery, the structures on the inside of the nose are carefully assessed and the relationship of the nose with the patient's overall facial structure is evaluated. Many people are just concerned about the nasal bump and shape of the nasal tip. The refinement in the nose can bring significant improvement in one's overall appearance and can make the eyes look bigger as well as emphasizing the cheeks. The masculine nose is much larger and wider compared to the female nose as it has more prominent ridges. The third most popular facial feminization surgery is jawline or chin contouring surgery. Now, the chin and jaw areas form the contour of the lower face. Certain characteristics of the jaw are considered typically male or typically female, and with facial feminization surgery one can achieve a jawline that is much more feminine and beautiful. Males tend to have a square shaped face with a heavier jawline, square chin and jawline which has sharp corners, while a female face has more rounded contours and soft features, and the lower jaw and chin have soft curves and more rounded edges. Jaw reduction surgery is one of the best ways to achieve a beautiful and attractive jawline. Before the procedure, the entire jawline and facial features are examined and then recommendations are made regarding jawline contouring. This surgery is performed under sedation or general anesthesia and can take 1 to 3 hours to complete. The incision of the jaw surgery is made within the mouth, so there is no external incision which is seen. Through this incision, the angle of the jaw can be contoured. The size of the jaw are adjusted by shaving the bone or by reducing certain muscle masses. Genioplasty or alteration of the chin is performed if there is squareness in the chin area. A jaw or a chin implant is also used in certain cases to alter the shape of the lower face to get an overall more feminine look. First of all, it is very important to understand that each person is completely different and each face is unique. Since each patient's treatment is distinct, there is no standard procedure. This type of craniofacial and face surgery are not the same for everyone. Procedures for each facial feature are adapted especially according to each individual patient's needs. For maximum results, we at Designer Bodies design and perform customized treatment plan to help each individual achieve their goals. Various other facial feminization surgery procedures are blepharoplasty, which is for eye bag removal, lip augmentation, cheek enhancement, eyelid surgeries, Adam's apple shave and orbital contouring. Many people also undergo body contouring procedures such as chest implants, hip augmentation treatments to achieve a more desired feminine body shape. In my next video, I will answer the most frequently asked questions related to facial feminization surgery. If you have any more doubts about facial feminization surgery, please write your doubts in the comment box and we will get back to you. If you liked this video, don't forget to subscribe to our YouTube channel Dr. Parag Telang and click on the bell icon so you get notifications as we upload new videos for you. Don't forget to like, comment and share on this video and keep watching us for more information on facial feminization surgery. I thank you for watching this video. For our international patients who may have queries and questions and some concerns about visiting India for their facial feminization, I would like to assure you that we have a team who takes care of your airport transfers, hotel bookings and booking your consultations with me for your facial feminization surgery. We have the best in class equipment at our center, and we use the latest machinery such as the use of piezo saw for jaw contouring and bony modification. So don't feel hesitant in writing your questions in the comment box, and we'll be happy to help you.